So here we are, 3 out of 5. Young physicians who Mary and I had a chance to change their minds, to look at things from another point of view. And many of you, I know you, you're physicians and dietitians and so on. It's been the same liberation for you to see the truth. You know, otherwise you just can't figure it out. Why is nothing working? Why am I so miserable? And that misery carries over into your family and to everything in your life. Why am I so miserable of being a doctor or a professional? Well, the reason is because you've been taught ineffective tools. And once you get it, once you as a patient get it, and somebody came up to me and said, thank you, I've been struggling, you've finally given me control because you've taught me about starch. Once you get it, then everything changes. The whole world opens wide to you. And our next presenter is near and dear to me because he has become a huge addition to the McDougall program. When I announced that he was joining us, they said, oh, no, I don't get to see Dr. McDougall anymore. Well, that's not true. Everybody's been through the 10-day program said, how in the world would you have done this without the additional help of this young man? And I look back and I say, really? You got cheated? Until he joined us, and now the McDougall program has so much more value. And you'd think I'd get to retire, right? You'd think I'd get kind of set back and I don't have to see patients and so on, but that's not true. For one reason, I love to see people, to touch people. That's my main professional enjoyment, is to interact with you. And I've been denied that opportunity. I get to see every patient during the program, during the physical examination, and during the follow-ups and so on. But I have a lot of the burden taken off me by the addition to our faculty. And I keep telling them, I said, you know, you're so darn good, I'm not coming anymore. I said, aren't you tired of this old man standing over your shoulder? And he says, no, I really want you here. And I believe him, even though I tell him the day is coming when you know, I'm not going to do this anymore. But he says, no, that's not going to happen. You're going to be here. And I really enjoy the relationship. I want to welcome for you, an audience, to one of the greatest additions to the McDougall program, and that's Dr. Anthony Lim. Anthony, come on up. And
thank you, Dr. McDougall. Good afternoon, everyone. It is a true privilege and honor. This is my first time speaking at the McDougall Advanced Study Weekend, and I'm very happy to be up here. I am a board-certified family physician. I did my medical training at Boston University School of Medicine. A lot of people oftentimes ask me what the JD stands for. It stands for Doctor of Jurisprudence, so I also happen to be a lawyer. I took the California bar exam, and I'm licensed in the state of California. One of the reasons I left law, I graduated, I took the bar, but one of the reasons I left law was actually because it tends to be a very adversarial profession. And so my focus, even during my time in law school, was mediation. And I just had this moment of insight this morning as did you all witness Dr. McDougall and the questions he was asking our two speakers? Dr. McDougall, I've never said this to you before, but if medicine does not work out, you have a future as a trial lawyer. Yeah. So as the poem goes, I took the road less traveled by, and that has made all the difference. Famous line by Robert Frost. You've heard from Craig McDougall, you've heard from Matt Letterman and Alana Polde, you're hearing from myself, and next you're going to hear from Tom Campbell. All of us took the road less traveled by going into plant-based medicine, but I will speak for myself and saying that it has been the most significant professional decision of my entire life, and it truly has made all the difference in my own life and I hope in the lives of my patients. So I'm going to share a little bit about my journey to where I am today. It's a little untraditional. You're going to be surprised. And some of the lessons, the valuable lessons that I learned along that route. So let's jump in. So we're going to start off, want to engage the audience. We're going to start off with multiple choice, okay? Now this is a picture. This is a picture from the 80s. Now, your job, we're going to do it by hands, is to guess which one of these, 1, 2, 3, 4, or 5, is me, okay? So, okay, I'm going to go one by one. So first, number 1. Okay, good. I did not have a sex change. Number 2. Okay. Number 3. Wow, we've got, this is the perfect multiple choice question. We've got a nice spread. Number 4, and number 5. Okay. So as it turns out, believe it or not, I am number 2. And this was me. I don't know exactly what age. This was probably about 9 years old. The one, you know, 1 and 4 are my younger female cousins, Stephanie and Josephine. What's hilarious is number 3 is my very close cousin. I just saw him in Minnesota for a wedding, and we played tennis every day. He is 10 days younger than me. And look at the size difference. So when we look at these photos, we crack up. And number 5 is actually my older brother, Jonathan, who's been a role model for me my entire life. And he's wearing his Fila shirt. He was an avid tennis player. Again, insight I just had this morning as I was looking over this presentation. Can you imagine Dr. McDougall's face if in the 1980s someone showed him this picture and says, guess what, John, number 2 is going to be the future medical director of your program. I think he would have gone into a state of shock. For the first time in his life, he would have been speechless. Now, life was not easy as the quote, fattest kid in my grade. I have strong memories of what I dreaded, absolutely dreaded physical education, PE, because that was the time when you had to change. And so I would always wait till all the other boys in my grade had changed, and I'd be the last one to change by myself before leaving the locker room. I have memories of swim parties. The worst parties in my world were swim parties. And so what I would do is I would jump in, of course, with my shirt on. And when I got incredulous looks from my friends and they'd say, what are you doing? Well, of course, I said, well, I'm cold. So that's why I'm wearing my shirt. Now, I did not get this way by accident. When I look back on that time, I am not surprised considering some of the standard American diet delicacies that I partook in. I had a very different childhood than Craig McDougall, what I used to say. So a few of my favorite childhood foods. Friday nights, that was when my dad and mom, they took my brother and I, we would always go out for Chinese food. But afterwards, it was located right near Wendy's. And we would always go through the Wendy's drive-thru, and I would get a large Wendy's Frosty, and it was in preparation, I wouldn't eat it then, it was in preparation for Saturday morning cartoons. So Saturday from 8 a.m. till 2 p.m., I would enjoy cartoons and by the end have consumed my Wendy's Frosty. My brother, he is a great cook, and when my parents were out, he had his go-to meal that he prepared for the two of us. It was Pillsbury croissants and corned beef hash. I loved this, and we would go through about 2 of each of these. I remember going to the ice skating rink, University Town Center. I grew up in San Diego. And my favorite place to go to, and I don't even know if they're still around, but I'm sure a lot of you will remember, was Orange Julius. And this was my favorite meal. I would get a corn dog, and then of course to wash it down, I needed to have an Orange Julius. And I never knew what they put in it, but it tasted really good. And just for fun, I looked it up yesterday. So it's basically milk or cream, orange juice, sugar, and a lot of other additives. And that's what an Orange Julius consists of. And then last but not least, my parents grew up in Singapore, and we would oftentimes go back during the summer to visit family. And there was a phase that I went through, the banana split phase. And I remember every uncle and auntie thought it was the cutest thing in the world, but we would essentially seek out restaurants to find out the best banana split. And I had to be the judge, so I would try one at every place. Now, the happy ending to this story is, of course, I did grow out of that sort of chubby phase of my life. I remember being in the bookstores, reading books on nutrition, and starting to eat healthier, exercise more, and I grew out of it. But it was a tough period, and it brings me to my first life lesson. That which does not kill us makes us stronger, by Nietzsche. It was not that period of my life and being made fun of and being insecure certainly is not fun, not something you'd ever want to go through. But I thought about it, and had I not gone through that, I don't think I would have developed this lifelong interest in healthy eating, and I really don't think I would be up here standing before you. The second thing is that experience taught me a deeper sense of humility and compassion and empathy that I don't think I would have developed otherwise. And so for that, I'm thankful. Now, as I mentioned, I did have a lifelong interest in nutrition after that. And so I went through various dietary phases. And the first dietary phase was just a few years later. And it was funny that Craig, in his presentation, talked about fat-free fig Newtons, because that was the phase I went through. The low-fat diet. And I remember this, all I cared about was this figure, total fat, 0 grams. If there was 0 grams of fat, it was free. And it was exactly what Craig mentioned, this sort of single-minded, simplistic, myopic focus on a single ingredient. And I remember it like it was yesterday, because guess what? In this paradigm, sugar was okay, was A-okay. And so what did that mean? Well, some of my favorite fat-free foods. There we go, the fat-free fig Newtons. The Entenmann's, you all remember the Entenmann's, the fat-free, there's fat-free everything, fat-free apple cobbler, fat-free chocolate cake, fat-free cupcakes. I had a field day, the Snackwells. I replaced my Wendy's ice cream, and instead I went to fat-free ice cream. Twizzlers, my brother and I, we would go through bags of these, because again, if you look at the back of the bag of Twizzlers, 0 grams of fat, and that's a free food, right? And then last, to wash all of this down, Grove Stand orange juice. We always chose Grove Stand because we liked the pulp, the pulp. And so we would go to the supermarket and get 2, 3 of these large sizes. And I remember drinking 2, 3 glasses, again, really truly believing that this was a free food. And as we know, this is certainly not the case. As Dr. McDougall and others have mentioned, just this past week, right, the paper came out in JAMA of Internal Medicine showing what the sugar industry did back in the 60s to influence the way we thought about coronary artery disease and its link to saturated fat, and deflecting the link between sugar and coronary artery disease. And this New York Times article came out that very same day, how the sugar industry shifted blame to fat. And it's funny how history repeats itself, because if you remember just 1 year ago, what made major headlines was Coca-Cola, right? And they were funding a lot of research to show the link, to divert the link of obesity and diabetes from sugar, and instead point to it as related to lack of physical exercise. And so they put all their energies into promoting more increased movement. So this brings me to life lesson number 2. If it seems too good to be true, it probably is. Now, I wish I could say that the low-fat phase was the only fad that I went through. But it lasted a while. I was talking with my wife, Jean, earlier today, and she still has memories of me in college. I met my wife, Jean, in my freshman year at Stanford, and she has memories of me taking the grilled chicken patties and literally blotting it with napkins to soak up any excess oil. So I was still in that phase for a while. But fast forward, and I'm embarrassed to say, fast forward to medical residency. And the next thing that hit was the low carb diet. And boy, was I suckered into this one. A prize will go to the person who at the end of this can guess what this is, okay? So in a low carb diet paradigm, right? Total fat, 39 grams, which would have been anathema in the low fat paradigm. Hey, this is free now. Fat is irrelevant. Great, 39 grams, bring it on. Saturated fat, 17 grams, that's fine. Oh, cholesterol, 120 milligrams, who really cares? Sodium, 1160 milligrams, I like my salt. That's what I care about, carbs. And I got so good at it, I could even get net carbs. So with carbs, you would take away the 3 grams of dietary fiber. So really, this was only net 8 grams of carbs. And I was like, yes. Protein, low carb, high protein. It was the dual goal. And this one had 33 grams of protein. We've got 520 calories, 351 coming from fat. Who wants to venture a guess as to what this is? Tuna? Okay, that's a good guess. Yep.
McDonald's quarter pounder without the bun.
Great guess. Very close, I'll go with that. In-N-Out. And not just any In-N-Out. This was an off-menu item. I felt very smug because you would not see this item on the menu. It's a protein-style burger. Your favorite burger wrapped in hand leaf lettuce instead of a bun. And you could only order that if you told them that you wanted it. And just in case, I'm sure a lot of you are having difficulty imagining what this looks like. This is what it looks like, okay? 2 patties, it's called a double. I got the double-double. I didn't just go for the single, I got the double-double. So 2 patties, 2 cheese, all wrapped around with lettuce. And I remember it like it was yesterday. I remember being at the In-N-Out. And because this was a free food, at the end of one, I was still hungry. So I ate 2. I ate 2 of these. Now again, if you added to the picture that person showed Dr. McDougall in the 80s and then said, well, 30 to 25 years later, he grew out of that, but this was what he was eating. Again, I think he would have gone into a state of shock. In that one sitting, I consumed 78 grams of fat, which is 120% of the recommended daily allowance, 240 milligrams of cholesterol, which is 80% of the RDA, and over 2,300 milligrams of sodium in that single sitting. And in my limited, sort of naive mentality, that was free. I just ate a healthy meal. And there's, okay, so let's be fair. Some of the things that are good about sort of low-carb paleo, they tend to move away from dairy. They tend to try and emphasize less processed foods. And they include lots of vegetables. So there are some good things. But here are really the 2 fundamental problems. One is there is no restriction on the amount of animal products consumed. And as you've seen study after study this weekend and from the past, this is just a recipe for disaster. So we've already talked about the double-double. My dad and I, the sons, Jonathan and myself, we had a way of influencing our parents, so we kind of all went into this low-carb endeavor together. And so my dad and I, we would go to Costco, and you know the rotisserie chickens at Costco, right? People are just lining up, waiting for them to come out and grab them. Well, we were always first in line, and we grabbed them, and we would grab more than 1, 2 of them, and we would easily consume half a chicken in a single sitting. And then eggs, I would eat 5, 6 eggs. Again, just similar to the low fat, it's just a different variation, again, thinking it was a free food. The other problem, though, of course, with the low carb is not just what it allows unrestricted amounts of, but it's what it excludes or limits. And that's all the good stuff, right? A healthy plant-based whole food such as potatoes, whole grains, legumes, and most fruits are restricted or excluded completely. So again, right, if it seems too good to be true, it probably is. Now, how did I go from this Neanderthalic, double-double, paleo, low-carb diet to a whole food plant-based way of eating? And it really came about with this aha moment that I had. It happened in July of 2014, so really just 2 years ago. And I was watching television. I don't usually have much time to watch television, but it just happened that summer that my 8-year-old, then 6-year-old son was doing Chinese school in San Francisco. And he was staying with my mother-in-law. And as a result, my wife and my then 2-year-old daughter wanted to spend more time with him. So she was down there in San Francisco, and I found I had more time on my hands. And so there I was, just flipping through the channels, and I came across PBS. And I saw this individual come on the screen who I'd never met before, Dr. Joel Fuhrman. And he mentioned 4 words that, despite 4 years of medical school, 4 years of college, 3 years of law school, and 3 years of family medicine residency, which prides itself on prevention and taking care of the whole person. Despite all that, I had never heard these 4 words before: whole foods, plant-based. And he made these completely outrageous claims about the power of a whole foods, plant-based way of eating to not just prevent, but reverse chronic illness. And you can imagine in my low-carb paradigm that this was hard to hear, because by this point I'm embarrassed to say I had actually advocated and recommended this to many of my patients, especially those with diabetes. I had told a lot of my colleagues about it. And so I had a lot invested in that. But I heard enough that I felt like I had to investigate further. And I remember it again like it was yesterday. The very next day, as my wife was coming up to Santa Rosa, because she works at Kaiser as a dermatologist, I was driving down. And I picked up my son from his Chinese class, and I said, "Joshua, we're going to the San Francisco Public Library today." And we checked out his books, and then I said, "Now it's Daddy's turn." And I checked out Eat to Live. And I read that book cover to cover that very same day. And I was so compelled by it, I got online, and you can't go very far online before you come across Forks Over Knives. And I watched that documentary start to finish. And then just for fun, I finally finished it up with Fat, Sick, and Nearly Dead, which talks about the journey of Joe Cross and his transformation, initially by juicing, but eventually transitioning to a plant-based diet. And by 4 a.m. of Friday, July 25th, 2014, I was a convert, okay? And that brings me to life lesson number 3, always keep an open mind, right? It can't tell you how many times I see this in medicine, that once you become invested in a certain track, it is very difficult to entertain new ideas, especially having told patients about this, especially having told professional colleagues and co-physicians about this. But had I not kept an open mind and being willing to listen to the evidence, I would not be here today, and I would still be at In-N-Out eating a double-double. Well, I would liken my conviction in plant-based, whole food plant-based diet to sort of a fire. With Joel Fuhrman coming across the screen, it started off as a spark. And then that day that I watched Forks Over Knives, read Eat to Live, it grew into a flame. But it wasn't until 2 months later, September of 2014, that this flame just grew into a huge bonfire. And what happened in September of 2014? The second International Plant-Based Nutrition Healthcare Conference. Pictures speak 1,000 words, and here there are multiple pictures that are going to speak 1,000 words. Dr. Dean Ornish, Dr. John McDougall, Dr. T. Colin Campbell, Dr. Scott Stoll, Dr. Caldwell Esselstyn, Dr. Doug Lyle, Dr. Michael Greger, Dr. Michael Clapper, Dr. William Lee. Dr. William Lee was actually scheduled to speak that weekend. He had a family emergency come up, and so he spoke 1 year later. Can you imagine listening to all these speakers in a single weekend, and study after study after study after study of how a simple plant-based diet, low in fat, can reverse chronic illness ranging from diabetes to high blood pressure to neuropathy to autoimmune illness? And when I look upon these pictures, I think of a quote that Craig has already mentioned, and it's no coincidence. I actually first heard it from Dr. John McDougall, who I consider to be an invaluable mentor. And it is that we stand on the shoulders of the giants who come before us. I learned that the original is a different variation, but Sir Isaac Newton was the one who originally came up with this, but I first heard it from Dr. McDougall. And he said this in reference to the people in his life who were mentors and pioneers in the field, Mr. Nathan Pritikin, Dr. Walter Kempner, Dr. Dennis Burkitt, and others. And so when I look upon these faces, on behalf of the next generation of plant-based physician, I truly do want to extend our deepest gratitude to all these pioneers and those not pictured, such as Dr. Barnard, Dr. Goldhammer, Dr. Furman, who have opened our eyes and are the reason that we're standing here talking to you about this today. So I'm happy to report that with that bonfire, I finally entered into what I truly do believe, and now I'm on record, staying in front of a film, that the final phase of my nutritional journey, which is a whole food, plant-based lifestyle. And notice that I use the word lifestyle. What I love about this is not a diet. This is not something I have ever said to a patient. I suggest you do this for a few months, get the results you want, and then you can, back off. This is a lifestyle. It's a way of living. I truly believe that when I'm 60, 70, 80 years old, I will still be eating the same way, which is essentially, say, a diet predominantly based on 4 food groups: fruits, vegetables, legumes, and grains. Notice that we're getting away from that paradigm of the low-fat, low-carb, which focuses exclusively on single nutrients as the bad or the good. So my double-double burger has evolved from this to a picture that was just taken at the last McDougall program, this. This is Jeff Novick's bean burger. This is Mary McDougall's mushroom burger. I can't decide, so I put them both in one. And then I surround it with a double whole grain patty. So this would have been absolutely off the dietary plan in my prior days. Now, as my diet has evolved, the question that oftentimes gets asked, more than I thought it would, is, well, what about your health? And in fact, it's funny, at just the very last program, I was sitting in on Jeff Novick's lecture, and he got a question from one of the participants that was a challenge. And the participant said, how do we know that you all, the ones that are talking to us, are actually healthy? How do we know? I mean, you look okay, but how do we know that you're truly healthy? And before I knew it, Jeff Novick was giving his cholesterol numbers in front of the audience. So in following in Jeff Novick's footsteps, I too will share some of my numbers. And I think it actually presents an interesting story. So this was my cholesterol in 2010. This was when I was eating, between the low fat and the low carb, I did go through kind of a Mediterranean-esque phase. And this was during the Mediterranean phase in my life. So my total cholesterol, not bad, 152, LDL of 93, triglycerides of 57, HDL of 48. Now I rechecked my cholesterol in the heyday of my low carb period. And this was when, I'm embarrassed to say, I think Craig made a reference to it, or one of them. I was checking my urine with keto sticks to see if I was in ketosis or not. My total cholesterol jumped to 179, my LDL to 116. My triglycerides had a little bit of a drop, 44, and my HDL a little bit of a rise to 54. Now, here's where it gets really interesting. 2 months after transitioning to a plant-based diet, in July of 2014, just over a year later, I rechecked my cholesterol, just curious how things have changed. My total cholesterol dropped by 56 points. My LDL was essentially halved from 116 to 62. And my triglycerides and HDL remained essentially the same. So clearly these biomarkers that we use to look at your risk for heart disease improved. On top of that, my whole life since high school, since I grew out of my chubby phase, I've weighed between 155 to 160 pounds. I wear a size 33 waist. And nothing I did would ever change that. And just like that, within a few months of transitioning to this, I have dropped down to 145 pounds, which I think is where my baseline will be. And I now wear size 31 pants, which I never imagined. In fact, it's kind of, the reason I'm not wearing a coat is that I haven't gotten a suit since college. So these pants and my jacket are my college suit, and these pants are actually a size 33, so I've cinched it kind of tight right now. I had to get a whole new wardrobe, right? All new pants. I think I need to get a new suit after this. And then finally, I'm a competitive tennis athlete. You heard Dr. McDougall today talk about his passion for biking. Tennis is my sport. And since moving to Santa Rosa, I've played in the USTA 4.0 tennis league every year. And in general, my record has been, if I'm lucky, above 50% wins versus losses. Well, I'm happy to share that this last season, I went for the first time in regular season undefeated. And thank you. And I really do attribute that in large part to just my improved fitness with plant-based eating. Now, with the evolution of my eating, in addition to my own personal health, probably even more impactful has been the evolution of my professional life. My first job after residency was working at Kaiser Permanente in their, Kaiser, for those of you who don't know, is a large integrated health maintenance organization. And I was working here in Santa Rosa. And I worked part-time seeing patients of all ages in the Department of Family Medicine. And after going to that conference that sort of lit me on fire, this plant-based conference, my first initiative is I looked into various ways of getting involved at Kaiser. And it just so happened that in Santa Rosa, there was a plant-based nutrition class that meets monthly. It was started by Dr. Sanford Warren, who is a cardiologist, he's now retired, over 5 years ago. It's the #1 subscribed class at all of Kaiser. We have anywhere from 40 to 80 people come out on a monthly basis. And so it just so happened that right around September, October, he had retired in 2014, and they needed a new doctor to pick up that class. And so, I happily stepped in. And since then, it's just been, I just had it this past week. We've had distinguished speakers. We've had Dr. Ben Brown, who heads up Dr. Dean Ornish's lifestyle program. I invited Dr. McDougall, and he came and spoke. Even my father, Dr. KB Lim, he's a retired OB-GYN, he came and spoke. And so that has been a very formative experience for me. But the real pivotal turning point is that if you remember how Dr. Joel Furman, right, he came across my screen and that sort of changed things. Well, on August 7th, 2015, I received an email. And I had not subscribed to the McDougall newsletter, so I hadn't, at this time, I wasn't receiving anything. But my mom, who I had, my parents and my brother's family, who I talked all about plant-based eating to now and helped them to kind of veer more in that direction. My mom had signed up for the McDougall newsletter, and she forwarded me an email on this date. Physician position open. We are looking to hire a physician for the McDougall program and TrueNorth Fasting Center. Now, you already know all about the McDougall program. You've seen the research. I'm not going to repeat it. They specialize in the 10-day programs, starch-based meal plans, medical care, and you saw the study, right? Over 2014 published study, over 1,600 patients, over 90% of patients have one or more of their antihypertensive or anti-diabetic medication stopped on day 1 of the program. And despite that, you saw the decreases in systolic blood pressure, diastolic blood pressure, as well as fasting blood sugar, not to mention the decreases in weight and cholesterol. So I was very familiar with the McDougall program. Dr. McDougall probably doesn't even remember this. I introduced myself at the Sonoma County Veg Fest. I just walked up to him and said, "Hi, Dr. McDougall, I'm Anthony." And he's like, "Okay, that's nice." And I don't know how much you've heard about TrueNorth, but just briefly, TrueNorth was started in 1984 by Dr. Alan Goldhammer. It is the only medically supervised water fasting facility in the entire United States and arguably the world. We do fasts anywhere from as little as 1 day to, believe it or not, as long as 40 days. And there is extensive published research on the power of water fasting for treatment of conditions, but most notably high blood pressure. And I didn't bring the graphs to show you here, but basically the higher people's blood pressure when they came in, the more significant the drop that they experienced through as little as a 10-day water fast. Just recently, this last year, British Medical Journal is one of the most prestigious journals, and TrueNorth had a case report published in British Medical Journal of a 42-year-old woman with follicular lymphoma who went on a 21-day fast. And it essentially showed after the 21-day fast, they had pre and post MRI images of her enlarged cancerous lymph nodes that had essentially shrunk to normal size. And so we were very excited about that. At TrueNorth, there's Dr. Clapper, Dr. Doug Lyle, of course, Dr. Alan Goldhammer. We have naturopaths, we have chiropractors, massage therapists, registered dietitians, people who help out with exercise. It's an absolutely wonderful team. And so I was again very familiar with Dr. Goldhammer. I'd seen him and now Dr. Lyle both lecture on the pleasure trap, which I found absolutely fascinating, just the idea that our food is hyperpalatable due to excess amounts of sugar, fat, and salt. And I had it, it's funny, I remember at the plant-based conference, I had it on my list of ways to start to increase my involvement in this field since they were in Santa Rosa and I was in Santa Rosa to one day visit both their programs. And so you can imagine when I saw this email, not just visiting, but the possibility to work with these two titans in the field and work at both these institutions just sounded too good to be true. I could not resist. I had to include my mom's email that came along with this. Dear Aunt, that's what she calls me, Aunt. Is this something you might be interested in? They both look like great wellness centers to be coordinating. With your skills and experience and interest, you'd be the perfect candidate. Love, Mom. Don't you just love moms? So, this is a life lesson that I probably don't need to repeat, but I will just, in case you need a reminder. Moms rule. All right. Thanks, Mom. That's my mom. This is actually my dad pictured here, but I cut him out. Okay. He's had a very formative impact on me as well, but you're going to hear from him later. So, okay, so moving on. As a result of being in the right place at the right time and my wonderful mother, this is my world for the last year, since August of 2015. I work as the medical director of the McDougall program. I work as a staff physician at TrueNorth Health. And I have continued to work part-time, much more limited, at Kaiser Permanente, where I see patients more of sort of like an urgent care basis, as well as continue to lead their monthly plant-based eating class. And one of the questions I'm asked most frequently is, what doesn't fit in this picture? It's Kaiser. Why do you continue to work at Kaiser? It's not necessarily considered the bastion of whole food plant-based eating. And I have a few reasons that I wanted to share. So I really do believe Kaiser Permanente has the potential to significantly influence the whole food plant-based movement. Kaiser is the largest managed care organization in the entire United States. Okay? It has over 10 million members, almost 20,000 physicians of all specialties, and 200,000 employees across 9 states, including the District of Columbia. President Obama, in an interview in Time magazine, cited as a model for the country to follow. My grandmother had been signed up under Kaiser Permanente for years, and it's actually one of the models of high-quality, cost-efficient care that's out there right now, partly because they maintain such a stable base of patients and they construct a whole team approach that has proven to be very effective. And I really can speak to this. I mean, you know, there are a lot of things that Kaiser does well, but three of the things that are notable is, one, they really do try to focus on prevention. Two, and this is interesting, is that their physicians are salaried. And the reason you can appreciate this is you heard Dr. Mandrola earlier today talk about the ablations and how in private practice, you know, you're basically paid per procedure. So naturally, there's this hidden incentive, although no doctor will ever admit it, there is a hidden incentive to do more procedures. If you're a salaried physician, you are not incentivized to do these procedures. And I think what would be a fascinating graph is to show the rise of ablations at Kaiser and compare that to the rise of ablations in practice. And I would bet that it has been a much less steep curve. And then the final thing that Kaiser has done really well is they have a very robust electronic medical record system that links all primary care doctors and specialists in this whole team approach. Other good developments at Kaiser is that they really are starting to grow in terms of their plant-based advocacy. This was a picture, you've now heard me talk a lot about this nutrition healthcare conference. This is a picture of all the Kaiser employees that were present at this conference. Here I am. And what is interesting is that this was the second annual conference, right? Guess how many Kaiser people were at the first one? There was less than 10. I think there was actually less than 5. And then at this second one, there was over 40. And then what's even more interesting is I went to the third annual one just last year, 2015. There was almost 100 Kaiser employees. So in the span of 3 years, it's grown from less than 5 to almost 100. And there were so many of us that they reserved a separate room just for the Kaiser employees. And at my table, I sat at a round table. At my table, I sat with a psychiatrist, a general surgeon, a pulmonologist, a nephrologist, and an internal medicine hospitalist, and myself. 6 specialties represented just randomly. We just all sat down at a single table. Not to mention the various disciplines, social work, registered dietitians, nurses, nurse practitioners. So considering that Kaiser is the largest healthcare maintenance organization in the US, I see this as very encouraging. On top of that, they're starting to publish more. This is a nutritional update for physicians that was actually published in the spring of 2013 by Drs. Tuso, Ishmael, Benjamin Ha, and registered dietitian Carol Bartolotto, essentially advocating a plant-based diet as a critical intervention for reversing chronic illness. And I captured one quote that I absolutely love, and I wanted to share that with you. This is from this paper. If we are to slow down the obesity epidemic and reduce the complications of chronic disease, we must consider changing our culture's mindset from live to eat to live. The future of healthcare will involve an evolution toward a paradigm where the prevention and treatment of disease is centered not on a pill or surgical procedure, but on another serving of fruits and vegetables. So my lesson from Kaiser is that together everyone achieves more. Teamwork is essential. Just this last week, I did a shift on Tuesday morning, saw 10 patients. And in one morning, I consulted with a gastroenterologist about a patient with long-standing reflux. And he was concerned about whether or not he needed an upper endoscopy to look for a precancerous condition called Barrett's esophagus. And so I got on the phone with a gastroenterologist and had a conversation. I had a woman present with a very unusual rash of her extremities, her feet and her hands. And I wanted to get some ideas, and so I called dermatology and we talked through it and came up with a really good plan. I saw a 19-year-old girl who came in with a BMI of less than 17, despite the fact that she didn't have, just for you all to know, that is very low. She weighed less than 90 pounds. And she reported no eating disorder, and she said she was trying to gain weight. And so I got on the phone with endocrinology and talked about the appropriate workup and what sort of labs we wanted to order. I had a video visit with a patient with this unusual knee swelling, or effusion, we call it, filled with liquid, even though he had no trauma to the knee. He had actually been, bumped his thigh against the gate of a tennis court, And since then, he developed a hematoma and just this fluid. But this was 5-6 weeks later. And so I got on the phone with physical medicine and rehab. I spoke with Dr. Todd Weitzenberg, who's the head of sports medicine at Kaiser, and he gave me invaluable recommendations for the care of this patient. I spoke with a rheumatologist and asked her a number of questions about gout. You know, a lot of medical practitioners, when someone presents with gout, they check a uric acid. But you know, the problem is that most of us check it at the time of presentation, and it turns out that your uric acid levels are not reflective of your true uric acid level at the time of the gout flare. So you're really supposed to wait a few weeks after and then check the uric acid level. And so I was talking to her about this as well as treatment options. And then finally, I saw a woman come in with the largest frontal neck lymph nodes that I've seen, otherwise healthy woman, and she was in her 20s. And I got on the phone with ENT, ear, nose, throat, or head and neck surgery, and spoke with the person there about whether we needed to do a biopsy, fine needle aspiration, or what the appropriate workup was. In half a day, 4 hours, seeing 10 patients, I was able to speak with 6 different specialists. And that's coordinated care. We have to work together, and that's how we're going to get better. But as much as I enjoy work at Kaiser, it really is my work at TrueNorth and McDougall that represent the reason that I entered medicine. You know, speaking for myself, and I think for most of us enter medicine with a simple desire, and that's to heal, you know, if possible, to cure illness. And yet, as you've heard time and time again this weekend, our experience is that our patients tend to get worse, right? Before our very eyes. We're sort of like, it's like a dam with holes, and we're just kind of poking our fingers to keep the dam from breaking down. And meanwhile, we're piling on medication after medication, procedure after procedure. And it's very, very frustrating. You even heard Dr. Mandrola say earlier, right? The irony that our medicines for atrial fibrillation are improving, right? You all heard him say that. And yet, the morbidity and the mortality from this condition is getting worse. And that's sort of the state of American healthcare. In contrast, what I've learned at TrueNorth and my time at McDougall is that it is very possible, miraculous as it seems, to not just prevent, but reverse illness. And you've heard a number of stories. I really do think stories speak a lot. I did get permission from the people who I'm going to share with you. These are 2 notable examples, and as Alana and Matt said, these are not atypical. We could, you know, choose many, but these are just the ones that we've happened to choose. So this is Gabrielle. She participated in the June McDougall program just this year. The picture you see here is just taken a week ago. She's happy, she's smiling, she's eating. Overall, she looks well. This has not been the case for her in general. She suffers from a severe inflammatory bowel condition called ulcerative colitis, okay? And as a result of this condition, she has lived for many years with over 8 to 10 bloody episodes of mucousy diarrhea per day. She has severe abdominal spasms. And when she came to us on the program, she was at her wit's end because she had just seen her gastroenterologist, and he was saying that in addition to the maximum dose steroid that she was taking called budesonide, the maximum dose anti-inflammatory medication that she was taking called mesalamine, and the mesalamine suppository that she was using on a daily basis, because your symptoms are not controlled, we need to yet add another. And so he talked about adding Humira. And it was at that point, which is a biologic medication, it's an immunosuppressant, has the potential for serious side effects. And it was at that point that she decided, she had heard about the McDougall program, and she came to see us. So Dr. McDougall, myself, Jeff Novick, we worked very closely with her during those 10 days. She needed actually special dietary preparations, not, that were unique to her situation. And she started to do better. And she was doing so much better that she decided to extend her stay. And this was the nice thing about working at both McDougall and TrueNorth. So she came over to TrueNorth and stayed for about another 2 to 3 weeks, and I oversaw her care there. The end result is that by the time she left TrueNorth in June, July of 2016, she was completely off all her medications. She had her first normal bowel movement with no diarrhea, just a normal formed stool, something many of us take for granted, in years. And she texted me one day. She's like, Dr. Lin, I can't believe it. I'm looking at my first normal formed stool. I could cry. I've forgotten what it looks like. She had no more abdominal spasms. And she could finally eat food again without pain. She got down to a low of about 88 pounds. She's now 103 pounds. She sent me a text a few weeks ago. I got my CRP test results back, and they are 1.3. A little bit of background. CRP stands for C-reactive protein. It's an inflammatory marker similar to another one called ESR, which stands for erythrocyte sedimentation rate. And these are often ways that we as doctors will monitor a patient's level of inflammation for diseases such as ulcerative colitis or rheumatoid arthritis. And so she was excited because 1.3, which is normal. I can't believe it. I went from a 20, where she was before the McDougall program, down to a 1.3. Never once on medication did I ever see a number that low. The doctor wanted to know what I was doing. He also told me a month ago I would need to go on Humira in August when I would see him again. He was astonished. And here you see Gabrielle eating. I asked her, what are you eating exactly? So it's a concoction of purple yam, white rice congee, and squash, zucchini, and I think a little bit of spinach, and all sort of pureed. So this is just one example of really a miraculous reversal. The next example, this is Ted. And this is a picture of him from a couple weeks ago. He just finished exercising. So Ted is a 63-year-old male. He stayed at TrueNorth for 4 weeks. He has a history of coronary artery disease with a stent placed. He had hypertension on amlodipine, and he had a condition called diastasis recti, which is sort of the separation between the rectus abdominis muscles. And he had seen his cardiologist and his general surgeon right before coming. And his cardiologist, given his history of coronary artery disease, said that we're going to need to really think about starting you on a statin or a cholesterol-lowering medication. And his general surgeon said, given this diastasis and how big the opening is, I'm concerned about potential complications. When you get back, let's schedule surgery to close this up. And so he came, he stayed for 4 weeks, and during that 4 weeks, he water fasted and then transitioned for the first time to a whole food plant-based. And at TrueNorth, they do a no SOS, which means no salt, oil, sugar way of eating. He lost 20 pounds. He came off his blood pressure medication, the amlodipine, which is a very strong blood pressure medication, with better blood pressure than when he came in. He left with blood pressures in the 110s over 70s. And what's most notable is that I got the update 5 weeks later when he got his labs checked, right before seeing his cardiologist. His total cholesterol had dropped 50 points, his LDL by 30 points, and his triglycerides by 50 points. And when he went to see his cardiologist, the first thing the cardiologist noted, he said, well, your blood pressure is looking good. Let's just continue the amlodipine. And so when Ted intentionally did not tell him, and so when he told him that he had actually stopped the amlodipine, the cardiologist was shocked. And then on top of that, he said, I know I told you that we would need to start a statin, but given this 50-point drop, I can't argue with that, and we're going to hold off. On top of that, his next visit a couple of days later was with the general surgeon. And it turns out that the way you measure the size of a diastasis recti, the opening, is you use like finger widths and you measure length. And so when he first measured, it was 3 finger widths and 8 centimeters. And when he went to visit him this time, it had shrunk to 6 centimeters and 1 to 2 finger widths. And so the general surgeon, based on that, said, you know what, I know we had talked about surgery, but I think we should just continue with weight loss. So he avoided a statin, possibly increasing another blood pressure medication, and a surgery to close a diastasis recti just by moving over to a plant-based diet. This doesn't even include certain other things, like the fact that every day he would drink 3 cups of coffee per day because he was so fatigued. And he went from that to, when I talked with him, 1 cup of coffee once a week, more as just an enjoyment than anything else. He was also taking high doses of aspirin and Advil on a daily basis for his weekly migraines, as well as his left shoulder pain, which, as we know, The dangers of what are called NSAIDs, such as aspirin and Advil, are serious, and people get serious bleeding events as a result. He had gone from taking 6 to 8 Advil on a daily basis, and I talked to him in the whole 6 weeks, 4 to 6 weeks since he had left, he had taken 2 Advil. So it's from patients such as Ted and Gabrielle that I arrive at lesson number 7. And this lesson was really imprinted on my brain by Dr. Dean Ornish at the 2nd annual plant-based conference. He was one of the first speakers that came on. And he showed this cartoon that many of you are familiar with, but it has stuck with me ever since. Instead of mopping up the floor, let's turn off the faucet. Okay, here is this picture that he shows. These are 2 doctors, and they are mopping up the floor, right? Meanwhile, the faucet is on full blast. And this is what we're oftentimes doing as we're adding a medication on top of another or doing another procedure, we're mopping up the floor. And with programs such as Dr. McDougall's and TrueNorth, we are finally in a position to turn off the faucet. Now, I wish I could say that with every patient that comes through, we turn off the faucet. I wish that were so, but as you just heard from the wonderful presentation given by Alana Polde and Matt Letterman, behavioral change is really, really hard. And it brings me to lesson number 8. There is a world of difference between knowing what to do and actually doing it, right? Most of the people who come through the programs, when they leave, there's no doubt in their mind that this is the way to eat. There's no argument. And yet, it is so hard to do. And I wanted to share just an example that really illustrates this from one of my patients who I work very closely with. One of the best tools to really understand why someone is not getting the results they want, and I recommend you do this, is very simple. It's a 2-week food log. And so I asked this patient who I worked with and was having difficulty to send me in a 2-week food log. So she clearly knew what to do. This is from 2 weeks. Look, oatmeal with blueberries and slivered almonds. 2 small corn tortillas baked crisp, topped with water sauteed mushroom, onion, red pepper, avocado. Steamed sliced potatoes, mushrooms with peas, carrots, green beans. She clearly, there's no question, she knows what to do. These are all on plan. And yet, it's like Dr. Jekyll and Mr. Hyde in this same 2-week period, very same 2-week period. Half a cheeseburger with avocado, corn fritters, lobster risotto, French fries with ranch dressing, mac and cheese, Starbucks blackberry sangria drink, but she made sure to add that it had half the sugar, 2 mini scones with butter and jam, and a crab cake sandwich and salad, right? Behavioral change is hard. And she knew, she would even highlight the things that were off plan. She knew, but it was very difficult to stop herself. And here's an email from another patient. I got permission to print this. It's a 50-something-year-old Caucasian female who, again, was struggling, and I had turned in 2-week food logs. And she entitled it, Pride Before Fall. Hi, Dr. Lim. So I felt quite proud of myself the last few days. Planned, prepped, and carried food on my flight, made my first stop at the grocery store for fresh fruit and veggies, made a 3-pound salad to last a couple days, and filled the hotel room fridge. Day 1, a success. Day 2, ate 100% on track, until the conference ended in an appetizer and dessert social. I was tired and over-the-top hungry and just didn't care at the moment. Ate cheese, crackers, Swedish meatballs, and dessert before going to my room to eat the thawed-out veg sushi. Smiley face. It's this kind of behavior that makes me feel crazy. And so I have this image of behavioral change as sort of like Sisyphus, who was the man damned to an eternity of rolling up this huge boulder up the hill. And just when he thinks he's got it, he's succeeded, boom, it comes crashing down again. And so this is why I focus a lot on it. This is why Dr. Doug Lisle has spends his entire life on the area of behavioral change. This is why at the McDougall program I give 1 lecture, and it is solely focused on behavioral change. And we could spend the rest of the weekend, we could spend the whole week talking about all the various tools, planning your meals, making sure your social circles are concordant with your beliefs, and knowing your why and being very clear on the long-term objectives that you're trying to achieve, arranging your physical environment to optimize success. We could talk all about that, but I just want to mention one. And I believe it is the one factor that is absolutely critical to whether a person will, in the long term, succeed in changing, I don't care what kind of behavior. It could be increasing exercise or getting to sleep earlier or being nicer to your wife and kids. It is the one factor that is critical, and it's one word and 4 syllables. Resilience. As Vince Lombardi, the head coach of the Green Bay Packers, said, it's not whether you get knocked down, it's whether you get up. If there's anything I've learned from working with patients over the last year, all of us are going to have setbacks. We're all going to fall, we're going to slip up, we're going to get knocked down to the ground. And the question is, are you going to be one of those that stays down and uses that as an excuse that's like, well, I knew I wouldn't succeed, see, this just proves it, I might as well stay down? Or are you going to get back up on your feet, dust yourself off? And I wanted to end with one last patient who I feel really embodies this idea of resilience. And this is Robert. This is a picture of him with his wife, the side profile. Now, Robert had tried for many, many years. He had many failed attempts. He had done the juice, fruit, vegetable juice. He had done the Atkins diet. He had done I think it's called MediFit, these MediFit protein shakes. And every time he actually succeeded in losing 30 to 40 pounds. But sure enough, as soon as he went off diet, right, and that's why I emphasize lifestyle as opposed to diet, he would not only gain it back, but he oftentimes gained back more. At his max, he weighed 298 pounds. And that was sort of similar to what he is pictured here. He was also on Norvasc amlodipine for high blood pressure, and he told me that even with amlodipine, his blood pressures were still in the 150s over 90s. That's with the blood pressure medication. He was on Zetia for cholesterol. He was on Pristiq, which is a selective norepinephrine reuptake inhibitor that is often used for anxiety. So he was on a high dose of Pristiq. He used an asthma inhaler because he would get chest tightness. And his wake-up call came when he saw these pictures. He saw these he was at a wedding, and he just, some light bulb went off, and it happened that he was reading The Pleasure Trap at the time by Dr. Alan Goldhammer and Dr. Doug Lyle. And he looked at the front and saw TrueNorth Fasting Center and decided to come out. So he came and he did a 25-day water fast. And this is him, so that was 2014. This is him today. I just took this the day before yesterday. He's currently staying at TrueNorth. And I said, Robert, I think people would be really inspired to hear your story. And I said, the reason I'm choosing you is, you know what? This is 2 years out now, right? This isn't just a few months out or 1 year. This is 2 years out. And I think, especially given all your failed attempts, rather than just give up, you were resilient. You got back up. And today he's 173 pounds, down from 298. His blood pressure, when I checked it, was 117 over 73, off the amlodipine. Remember, 150s over 90s on the amlodipine. He's off Zetia for cholesterol. He's off Pristiq for his anxiety. His inhalers are a thing of the past. He used to be sedentary, not move, and now he's running 5 miles a day. And I think what's most interesting is, and in a way, a reason for hope, and also a message that you're continuing to hear, is that it's not all or nothing, because he told me that he is not 100% adherent. He tries, but he's not. He said, I am a food addict. In fact, I am a sugar addict. And every now and then I have a slip up, right? And I eat way more of something I'm not supposed to than I should. But he said the key is that it really never lasts more than a day, because just the way I feel, it's so awful, I just get right back up and I get back on the plan. And so I hope that all of us in all our various endeavors in life will sort of learn to develop that kind of resilience that we can get through and overcome the setbacks that we encounter. So okay, well anyways, That was my last slide. I just wanted to conclude with a recap of here we go. The life lessons learned. That which does not kill us makes us stronger. If it seems too good to be true, it probably is. Always keep an open mind. If I hadn't kept an open mind, I wouldn't be here right now. We stand on the shoulders of the giants who come before us, a deep gratitude. And you heard this from Craig McDougall, right? And I think the theme you're hearing is just this deep sense of gratitude on the part of us. And you heard this from Matt Letterman and Alana Pulley, a deep sense of gratitude for all the work that pioneers like Dr. McDougall and Dr. T. Colin Campbell and Dr. Caldwell Esselstyn have done. Mom's rule. Together we achieve more. Instead of mopping up the floor, folks, let's turn off the faucet. Knowing and doing are two very different things. Behavioral change is super difficult. There's a lot of things we can do, but one key is develop resilience. Thank you very much.
All right. Well, thank you very much. Let's see if we can get back together in 5, 6, 7 minutes. Okay. Set back, and I don't have to see patients and so on. But that's not true. For one reason, I love to see people, to touch people. That's my main professional enjoyment, is to interact with you. And I've been denied that opportunity. I get to see every patient during the program, during the physical examination, and during the follow-ups and so on. But I have a lot of the burden taken off me by the addition to our faculty. And I keep telling him, I said, you're so darn good. I'm not coming anymore. I said, aren't you tired of this old man standing over your shoulder? And he says, no, I really want you here. And I believe him, even though I tell him the day is coming when, I'm not going to do this anymore. But he says, no, that's not going to happen. You're going to be here. And I really enjoy the relationship. I want to welcome for you, an audience, to one of the greatest additions to the McDougall program, and that's Dr. Anthony Lim. Anthony, come on up.
Thank you, Dr. McDougall. Good afternoon, everyone. It is a true privilege and honor. This is my first time speaking at the McDougall Advanced Study Weekend, and I'm very happy to be up here. I am a board-certified family physician. I did my medical training at Boston University School of Medicine. A lot of people oftentimes ask me what the JD stands for. It stands for Doctor of Jurisprudence, so I also happen to be a lawyer. I took the California bar exam, and I'm licensed in the state of California. One of the reasons I left law, I graduated, I took the bar, but one of the reasons I left law was actually because it tends to be a very adverse. Memories of swim parties. The worst parties in my world were swim parties. And so what I would do is I would jump in, of course, with my shirt on. And when I got incredulous looks from my friends, and they said, what are you doing? Well, of course, I said, well, I'm cold. So that's why I'm wearing my shirt. Now, I did not get this way by accident. When I look back on that time, I am not surprised considering some of the standard American diet delicacies that I partook in. I had a very different childhood than Craig McDougall, but nice to say. So a few of my favorite childhood foods. Friday nights, that was when my dad and mom, they took my brother and I, we would always go out for Chinese food. But afterwards, it was located right near Wendy's. And we would always go through the Wendy's drive-thru, and I would get a large Wendy's Frosty, and it was in preparation. I wouldn't eat it then. It was in preparation for Saturday morning cartoons. So Saturday from 8 a.m. till 2 p.m., I would enjoy cartoons and by the end have consumed my Wendy's Frosty. My brother, he is a great cook, and when my parents were out, he had his go-to meal that he prepared for the two of us. It was Pillsbury croissants and corned beef hash. I loved this. And we would go through about 2 of each of these. I remember going to the ice skating rink, University Town Center. I grew up in San Diego. And my favorite place to go to, and I don't even know if they're still around, but I'm sure a lot of you will remember, was Orange Julius. And this was my favorite meal. I would get a corn dog, and then of course to wash it down, I needed to have an Orange Julius. And I never knew what they put in it, but it tasted really good. And just for fun, I looked it up yesterday. So it's basically milk or cream, orange juice, sugar, and a lot of other additives. And that's
So here we are, 3 out of 5. Young physicians who Mary and I had a chance to change their minds, to look at things from another point of view. And many of you, I know you, you're physicians and dietitians and so on. It's been the same liberation for you to see the truth. You know, otherwise you just can't figure it out. Why is nothing working? Why am I so miserable? And that misery carries over into your family and to everything in your life. Why am I so miserable of being a doctor or a professional? Well, the reason is because you've been taught ineffective tools. And once you get it, once you as a patient get it, and somebody came up to me and said, thank you, I've been struggling, you've finally given me control because you've taught me about starch. Once you get it, then everything changes. The whole world opens wide to you. And our next presenter is near and dear to me because he has become a huge addition to the McDougall program. When I announced that he was joining us, they said, oh, no, I don't get to see Dr. McDougall anymore. Well, that's not true. Everybody who's been through the 10-day program said, how in the world would you have done this without the additional help of this young man? And I look back and I say, really? You got cheated? Until he joined us, and now the McDougall program has so much more value. And you'd think I'd get to retire, right? You'd think I'd get kind of...
I did not have a sex change. Number 2. Okay. Number 3. Wow, this is the perfect multiple choice question. We've got a nice spread. Number 4. And number 5. Okay. So, as it turns out, believe it or not, I am number 2. And this was me. I don't know exactly what age. This was probably about 9 years old. The one and 4 are my younger female cousins, Stephanie and Josephine. What's hilarious is number 3 is my very close cousin. I just saw him in Minnesota for a wedding, and we played tennis every day. He is 10 days younger than me. And look at the size difference. So when we look at these photos, we crack up. And number 5 is actually my older brother, Jonathan, who's been a role model for me my entire life. And he's wearing his Fila shirt. He was an avid tennis player. Again, insight I just had this morning as I was looking over this presentation. Can you imagine Dr. McDougall's face if in the 1980s someone showed him this picture and says, guess what, John, number 2 is going to be the future medical director of your program. I think he would have gone into a state of shock. For the first time in his life, he would have been speechless. Now, life was not easy as the quote, fattest kid in my grade. I have strong memories of what I dreaded, absolutely dreaded physical education, PE, because that was the time when you had to change. And so I would always wait till all the other boys in my grade had changed, and I'd be the last one to change by myself before leaving the locker room. I have a serial profession, and so my focus, even during my time in law school, was mediation. And I just had this moment of insight this morning as did you all witness Dr. McDougall and the questions he was asking our 2 speakers? Dr. McDougall, I've never said this to you before, but if medicine does not work out, you have a future as a trial lawyer. So as the poem goes, I took the road less traveled by, and that has made all the difference. Famous line by Robert Frost. You've heard from Craig McDougall, you've heard from Matt Letterman and Alana Polve, you're hearing from myself, and next you're going to hear from Tom Campbell. All of us took the road less traveled by going into plant-based medicine. But I will speak for myself and saying that it has been the most significant professional decision of my entire life, and it truly has made all the difference in my own life and I hope in the lives of my patients. So I'm going to share a little bit about my journey to where I am today. It's a little untraditional. You're going to be surprised, and some of the lessons, the valuable lessons that I learned along that route. So let's jump in. So we're going to start off, when I engage the audience, we're going to start off with multiple choice, okay? Now this is a picture. This is a picture from the 80s. Now your job, we're going to do it by hands, is to guess which one of these, 1, 2, 3, 4, or 5, is me, okay? So, okay, I'm going to go one by one. So first, number 1. Okay, good.